He was my neighbor, a guy my age, not my patient, a man of many talents and interests, and a dear friend. He was one of those fellows who would give the shirt off his back to help you if needed. When he was diagnosed with cancer of the pancreas spread to the liver, he, his daughters, and his friends knew how this was likely going to go. But we didn't realize how graciously he would handle his dying process until it happened. He was treated and truly helped by chemotherapy for a while, but gradually the tumor cells developed resistance to the drugs. The oncologist suggested no more chemo. He was ready to have only pain medicines and hospice. In the end, per his direction, with the help of hospice and the caring people at the Arlington nursing home, he shuffled off this mortal coil comfortably, surrounded by his family and friends. Fortunately, he had a compassionate and grounded primary care doctor and oncologist team who were realistic and knew when to stop intervention. He had loving daughters and friends to surround him with support, plenty of ready-to-heat and eat tater-tot-like hot dishes, an advance directive that said he was not to have medical intervention if pointless, and plenty of pain medicine for comfort. When I visited him 2 days before his death, despite an expanding belly full of cancer, he told me he was without pain. Most important, he was absolutely not fearful, but courageously accepting that dying process. In comparison, I find it tragic and too common that patients and families are overwhelmed with the fear of death. Some suggest this disabling dread comes from our cultural practice of protecting children from seeing death, with the intent to make life easier on them. Thus, a lifelong apprehension and running from death has become the norm. Consequently, we expect modern medicine to save us in the end, which can be a desperate, futile, and harmful hope, especially in an end-of-life situation. What's more, physicians struggle taking the time and the challenge of helping people in denial face their dying process. Bottom line, too many people choose to be dragged through unnecessary suffering at the end of their lives, and too often doctors comply. Rather, dying people should ask for and be reassured that enough comfort medicine will be provided and that it's going to be all right. Our profession has been improving in this regard, but certainly we could do better. When it's time, we should all have the opportunity for a gracious death, just like my neighbor.